Hello and welcome to this special program. Now, hearts are more than just emojis or greeting card decorations. They are the fist-sized engines that power the entire human body. And problems with the heart can therefore affect the entire body, which is what makes heart disease such an important public health issue. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or symptoms of heart disease, and that's not all. Cardiac emergencies can also occur at any time or at any age. What do we mean by that? Well, sudden cardiac arrest and heart attacks are such emergencies. Now, even young adults can suffer from sudden cardiac death because of sedentary or stressful lifestyles, and without immediate recognition and cardiopulmonary resuscitation, chances of survival decrease significantly with every minute that passes without these life-saving measures. It's been proven that bystander CPR can improve the rate of survival by almost 50%, and it's perhaps particularly important if you have someone in your life who has a history of cardiac disease. Save a Life is such an initiative through which people are being made aware of the early signs and symptoms of cardiac arrest so that interventions can take place. Today, as always, we're joined by eminent cardiologists who can help us understand sudden cardiac death and the role of CPR to revive and save a life. Joining us today, Dr. Nitish Kumar Ranjan, who's a consultant cardiologist with the Asian City Hospital in Patna. Dr. Raman Raj, who is an interventional cardiologist with the Heart Care Clinic in Asansol, and Dr. T Subburaja, who's an interventional cardiologist and managing director of the SPT Hospitals, Coimbatore. Thank you all for joining us. Dr. Ranjan, let me begin with you. What are the major risk factors for heart disease, and are women as prone to heart disease as men are?
Yeah, good afternoon. We have certain cardiac risk factors. They are divided into modifiable risk factor and some are non-modifiable risk factor. So non-modifiable risk factors are age, male more than 45 years of age, female more than 55 years of age, family history, strong family history of heart disease, and the strong genetic predisposition. These are some non-modifiable risk factors. Some of the risk factors are modifiable, where we can intervene, where we can take some medicines, we can take certain precautions to avoid heart attack, like obesity, diabetes, blood sugar more than 200, uncontrolled hypertension, BP more than 140/90, sedentary lifestyle, stress, smoking, and consumption of junk foods. Hello.
Yes. Dr. Raj, how does a person differentiate anginal pain from pain caused by a heart attack? Dr. Raman Raj?
So, good afternoon, everyone. Angina and heart attack are the continuum of the same disease. Angina is the symptom and heart attack is the disease. So, angina occurs when angina is called a chest pain due to cardiac causes. So, angina occurs when there is subtotal occlusion of the heart artery supplying the heart. So, when it is subtotal, the patient experiences chest pain, and this is called angina. When this subtotal occlusion becomes total, the patient suffers severe angina. The same pain occurs with much more severity, and the heart muscles get damaged, and thus then we call it a heart attack or myocardial infarction.
Right. Dr. Subburaja, what are the various tests that are available to detect the risk of heart attacks?
So, good afternoon. Mainly the patients are unaware still that they have diabetes mellitus. So, doing a blood sugar test, basic test is required, and checking their blood pressure, checking their cholesterol level is very important. And by doing an ECG, they can detect an early heart attack in an early stage. And there are other test modalities like an echocardiogram, which can detect the heart function, the valve function as such. And there are treadmill tests, that is the stress test, this treadmill test, to assess whether during the stress period or during their excessive activity there is any change in their cardiac conditions. And there are methods like dobutamine stress test for whom they are unable to do a treadmill test, and there are cardiac MRIs available to detect a heart disease in an early stage. And once they are affected with problems, an angiogram, either a CT angiogram or a conventional angiogram, can tell what is the problem. And there are many newer modalities like IVUS, that is intravascular ultrasound. We see the vessel from inside, and OCT, optical coherence tomography, with which we are able to analyze whether the vessel is okay even after a stenting is done.
Right. Dr. Nitish Kumar Ranjan, what are the preventive measures that will actually help reduce the risk of heart attacks?
Yes. As we know, the prevention is always better than cure. So we should focus upon them. We should keep our body weight under control. We should keep our diabetes, hypertension under control with regular medications, and to visit with a regular cardiologist so we can control this diabetes, hypertension. And our cholesterol level should be controlled. We should quit smoking. We should take healthy diet. We can adopt the DASH diet, Mediterranean diet. These diets are very much helpful to reduce the cardiac risk factors. We should quit smoking. We should stop doing a strenuous, gym activity, because whatever we are seeing nowadays, we can prevent them. And definitely our life should be stress-free. We should focus on good exercise regime in our daily routine, like 150 minutes vigorous activity per week is at least essential to keep our heart healthy and keep ourselves going in a healthy way.
Right. Thank you very much indeed for that comprehensive answer. Dr. Raj, if I can come to you, what are the most common treatment options for a heart attack, and what happens the longer a person goes without treatment in the event of a heart attack?
So there are many treatment options for heart attack. First of all, we give some blood thinning medicine that are called antiplatelets. These are given to everyone after a heart attack. And we can either give clot dissolving medicine that is called thrombolysis in the form of various thrombolytic agents, or we can do a primary angioplasty that is called angioplasty or PTCA, primary PTCA, just by mechanically opening the blocked arteries by balloon and then putting a stent. So this is called primary angioplasty. By dissolving clot by medicine, we call it thrombolysis, and everyone gets also blood thinning medicines like antiplatelets. In severe cases, you may also do emergency cardiothoracic surgery and open heart bypass surgery. So these are the modalities: antiplatelets, thrombolytics, primary angioplasty, or open heart bypass surgery. So if a patient does not get treatment for longer period, his or her heart will be damaged much more, and in the extreme cases, it may prove fatal also.
Thank you for that. Dr. Subburaja, is chest pain normal after a heart attack?
So not really, because not all get a chest pain when they have a heart attack. So the percentage varies from anywhere from 70 to 90%. They'll have a classical chest pain, and usually it is a central chest pain radiating to the back, to the left shoulder, to the jaws, or to the left arm. And there are other modalities like it is called chest pain equivalent, where they have only burping, they may have only vomiting, they may have only palpitation or breathlessness, which is leading to a chest pain as such.
Right. If I can just quickly follow up on that also, Dr. Subburaja, what exactly is cardiac rehabilitation and why is it important?
So cardiac rehabilitation is very important after a post-surgery, cardiac surgery, or a post-angioplasty, because the naturally occurring vessel is itself getting blocked. So in order to maintain the patency of the vessel, you need a proper lifestyle change and a proper rehabilitation so that you carry out the success of the procedure as such. So namely, the cardiac rehabilitation as such improves your quality of life, improves your preference for doing an exercise, and it helps you to quit smoking. It helps you to do some physical activity, get involved into the exercise pattern, and have a healthy diet. Make yourself stress free and learn to become stress free with these cardiac rehabilitation. And in fact, a patient who has not been troubled with these, if they do exercise, there might be collateral formation in the heart, so that they can be alive even they have a major heart attack in future.
Right. All right. Thank you so much. We will take a very quick break at this point, but lots more to talk about, and of course, including the difference between heart attacks and sudden cardiac arrests, and much, much more. We'll be back in just a moment. Welcome back to Health and Wellness Save a Life. It's been proven that bystander CPR improves the rate of survival by almost 50%, and it's particularly crucial if you have a loved one with a history of cardiac disease. Well, we've been speaking with eminent cardiologists who help us understand sudden cardiac death as well as the role of CPR to revive and save a life. Let me go right back to Dr. Ranjan first. As most people still don't really know the difference, doctor, between heart attacks and sudden cardiac arrests. People could perhaps mistake recognizing the symptoms. How do we know if it is in fact a primary cardiac arrest? Dr. Nitish Kumar Ranjan?
Yes, good question. As Dr. Subburaja was discussing, that heart attack is a layman term. So if any person getting chest pain, sweating, pain radiating to arm and jaw with chest heaviness, that can, if it is lasting more than 20 minutes, that is categorized as a case of heart attack. And on the basis of their ECG changes and other modality, we used to decide whether it's a STEMI, NSTEMI or unstable angina. So whatever this type of pain they are getting, that is in our general public term, we call it as a heart attack. This heart attack sometimes may lead to cessation of cardiac pumping all of a sudden. So that causes that cardiac arrest where people used to lose their consciousness, they can fall on the ground, they are not aware with their surroundings. That is called as cardiac arrest, which sometimes used to happen due to heart attack, sometimes due to electrical complication of heart post heart attack, sometimes due to mechanical failure of heart. These all culminate into a cardiac arrest. So in that case, we have to be very alert and we have to start CPR and we have to rush that patient very timely to nearby hospital for further treatment.
Right. Dr. Raj, how many different types of CPR are there, and which CPR can actually be performed by an untrained person?
So actually CPR is cardiopulmonary resuscitation, as just told by you that heart is supplying the blood and necessary oxygen and nutritive material to all the vital organs. So its continuous action is very necessary for life. And if suddenly heart stops, then the person becomes pulseless and unconscious. And when you are confirmed that the person has become just unconscious and his or her pulse is not there and he is not conscious, then you have to start CPR, that is cardiopulmonary resuscitation. So basically there are two types of CPR, that is only cardiac compression or cardiac compression plus rescue breathing. So if you are trained in doing CPR, the trained person can do CPR with cardiopulmonary resuscitation both, that is chest compression and rescue breathe through. But if someone is not trained, then he can do chest compressions again. So how to do chest compression? If I can just show you the example. So suppose this mannequin here is just became unconscious person, and I have confirmed that there is no pulse. So I have confirmed that there is no pulse and just become breathless. So there is no breathing. So I have to start the chest compression. So let me stand first, then So you have to give chest compression by just putting your both hands in between the chest, preferably in between the both nipples, and then your dominant hand should be below and non-dominant hand should be above, and fingers should be interlaced, and then you have to give compression for at least 2 inches with a rate of 100 to 120 per minute. So like this, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this you have to continue for at least 2 to 3 minutes, then again recheck for breathing and pulse. So this is how the chest compression is done. And this is the chest compression in the CPR. And if the person is trained with CPR training, then he can do chest compression along with respiration. So these are the 3 types of CPR, that is cardiac resuscitation.
Right. Dr. Raj, thank you very much for that demonstration, and having that kind of visual example makes such a difference in a program like this. Dr. Subburaja, what are the risks associated with CPR? If you could tell us a little more about that, and how likely is CPR to work in situations such as these?
So, as you already told, it is a life-saving procedure. So there are no much risk or complication for doing a CPR, because once a bystander starts CPR until the patient reaches the hospital, there are the possibility of life-saving is 3 to 4 times increased to save a life. So as such, there is no big complication to put into mind, except a minor rib breakage if it is very forceful. That's it. So we shouldn't bother about that because we save a life and we are a savior in that. And how does it work is, basically your heart is the main motor which pumps or maintains the circulation to entire the system. And when it stops functioning, the entire system doesn't get blood, and the oxygenated blood is also not received, and the circulation is also not happening. So immediately patient goes for unconsciousness because blood doesn't reach the brain. So what happens is, when you start giving a CPR, it is cardiopulmonary resuscitation. You start doing a cardiac massage, which Dr. Raj clearly explained. And when you compress the heart, it is the similar function of a normal heart. So we are doing it from outside. So the circulation starts pumping, and the blood reaches to various organs. And at the same time, you have to give respiration, that is breathing also. So the oxygenated blood, the blood gets oxygen, and that supplies to the entire organ, and the entire organ becomes active immediately. So this portion is very important to because of cardiac massage, once it is stopped, unless until it is restarted on its own, by giving a cardiac massage, we may not be able to save a life. So there are no much risks or complication in doing a CPR. It is very important to save a life.
Right. Dr. Ranjan, is it possible to lead a normal life after a cardiac arrest?
Yes, ma'am. Sure. If a patient getting timely CPR or timely intervention, definitely will be able to restore their cardiac function, their rate and rhythm. In follow-up, if we are helping him through cardiac rehabilitation program with the proper medication, definitely they can get their heart pumping restored to normalcy in most of the cases. So such patient can lead a very healthy life in future course, and there will be no such risk again. So key is the timely rescue of the patient through CPR and the timely intervention and proper medication and follow-up. By doing all these, we can restore their heart to the normal state.
Right. Dr. Raj, what is the relationship, if any, between heart problems and blood sugar?
Yeah, blood sugar, as commonly known, high blood sugar is commonly known as diabetes. So high blood sugar or diabetes is a risk factor for heart disease. Risk factor, that means it increases the chances of getting heart disease in future. So if one has diabetes, it increases his or her chances of getting getting heart disease in future. And diabetes damages both the arteries and the nerves of the heart and body. So there is more cholesterol deposits and more chances of getting heart disease in future with patients who are having diabetes, and they are also will have some neuropathy, that is damages of nerve, so that they may not experience the pain of heart attack or angina. So there can be a silent heart attack in patients who have diabetes. So diabetes is also associated with other risk factors of heart disease, and they coexist most commonly, like hypertension, like high cholesterol level, etc., and diabetes. All can coexist in the same person, and when they coexist, they increase the chance much more of getting heart disease. So, thus, after diabetes is increasing the chance of heart disease and also increasing the chance of getting painless heart attack and neuropathy.
Right. All right. Thank you very much indeed, all three of you, for answering many questions and making things so much clearer for our viewers, for all of you. Thanks for watching Health and Wellness Save a Life.